Yes, I'm here.
Commissioner Lawrence
Yes, loud and clear.
and Commissioner Chan, were you able to figure out your audio issue? Commissioner Chan? You able to hear us, Commissioner Chan?
I believe Lori Robertson is calling him right now, so he may not.
Might just be the mute on his computer, because we could hear him.
Yeah, we're reaching out to Commissioner Chan to troubleshoot with him.
Okay.
Can you hear me?
We can hear you. Can you hear us?
Yeah, okay, yeah,
All right,
okay.
great. All right, 7:01, we'll call to order the Board of Commissioners meeting for South County Fire's regular meeting on December 7th, 2021. Could I have those at headquarters stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to make one change on the agenda. We'll be removing item 13B, our executive session for potential litigation pursuant to RCW 423110. Make a motion to approve the agenda as presented. Is there a second? Commissioner Lawrence? Any discussion on the motion? Seeing none, all in favor say aye.
Aye.
Great, motion carries. Moving on to our consent agenda, items 4A through 4I. We have a motion to approve the consent agenda as presented. Commissioner Teoflack, do you have a second on the motion? Commissioner Metter, and any discussion on the motion?
Yes,
Commissioner Metter, then Commissioner Kenny.
I have just a question, not specifically, but on page 13, I see that we dispersed $11,900 to a left one claim. And my question is, knowing a little bit that the individual has Medicare, and I think he's covered by our insurance. So my question is and not getting into the specifics tonight, but that seems like an awful extraordinary amount of money for a left one claim, given if it is covered by Medicare, or I don't know if it was covered by Medicare or not, but the concern would be, I've never seen a claim that large, if you will. I'm just asking if staff can look into that and maybe report back as much as you can. I understand can't get into the medical details, but it does seem a very expensive, left one claim. So that's that's on page 13. Do you want the claim number, or can you find that?
Oh, we've got it. So 1074-9.
Okay, there you go.
Great. I'll have staff look into that and get back to us.
Yeah.
Any other questions, Commissioner Metter?
No, I'm fine.
All right. Commissioner Kenny?
Thank you. Chief Hovis, a couple of questions for you from the bills or the invoices. At page page, page 16 and 17. It's under Bank of America, 7655. It's actually listed first on page 16, teleprompter accessories in the amount of $113.99. And then on page 17, a teleprompter, $219.70. Thanks for your email response to my question that wasn't indicated in the invoice materials or the materials. We see that was related to a Verdant Falls grant. But can you describe for me what is the intention of a teleprompter and teleprompter accessories?
Thank you, Commissioner Kenny and commissioners. Yeah, to dig in a little bit more deeper with that, what we found with our community outreach team and just our engagements in general with the community, that we're obviously using a lot more video. And we've been using a cell phone now to take videos, and it can get very awkward. And even back to the days of our making videos for the fire benefit charge and other things, cue cards can be a little bit awkward with our engagements. So with this equipment, it'll be easier to make a higher quality video and to have more outreach and community engagement to be able to do that with Jean-Marie Guzman, PIO Hines, the chiefs, commissioners, just at events themselves. We're actually thinking about this technology also to be able to increase engagement and to use a teleprompter to communicate to those that don't speak English, so that when we're communicating even in a live event, we could program in a translation and have that in a teleprompter format as well. And thinking back to some of the videos that we did do COVID too, to engage some of our non-English speaking communities and BIPOC communities, it's been helpful to do that, especially some of the firefighters that we've used that speak Ukrainian and Russian, Mandarin, Spanish, to be able to do that, because they're a great face for our community and they're not used to making videos. And sometimes this teleprompter will help with that as well. So I could probably go on and on about that, but that's what the intent is.
Great, thank you. I did have one other question on the bills, but it actually relates to Mr. Davis. And as long as we have Rich Davis here on the call, I did have a question, and this is related, to page 31 out of 66, our Schmelik, Sitkin, and Davis invoice for October legal services in the amount of $8,743.53. Good evening, Mr. Davis. I did send you that a little bit before the meeting because I did want to ask you a question out of it at page, looks like page 4, I guess it's page 3 of your billing. There's a notation for October 29th, 2021. Are you actually looking at it, or?
I'm just getting there, Commissioner Kenny.
Oh, sorry. So in that line for 10/29/2021, it's a large paragraph, but the portion I'm interested in, it says chart of differences between use agreement and fee title for Mill Creek discussion. My question is, can you describe what that is? What were you putting together there?
Yeah, that was a chart that during one of our meetings that we had that Karen Reed has been facilitating on behalf of the city of Mill Creek. She put together kind of a template of a chart. There have been discussions about whether the Station 76 would be transferred to the fire authority or whether there would be a use agreement for use of that station if the city annexed into the RFA. And so in order to provide some context for a meeting that was coming up the following week, she created just the bones of a spreadsheet where we could kind of analyze the differences between those two. So what would it mean, for instance, if we had a use agreement and we needed to make capital repairs to that facility? How would a capital repair be implemented? It's a public work, it's the city's building. What would the process be? So that chart was designed to kind of highlight the differences between those two potential outcomes.
Okay, great. Thank you very much. And no further questions on the motion. Thank you.
Any other questions? Commissioner Chan?
Yeah, I think this, actually, I want to thank Commissioner Matter bring out the left one claim. Actually, that might be involved with Rich Davis. I know the left one have the left one review board on approving the charges. If the charges we seem to be, I don't know, whatever, out of order, whatever, can we challenge that board? Or this is really completely independent, really nothing we can do?
So we've been down this path once before,
Right.
actually, when charges were, we deemed them to be beyond the authority of the left one review board. And so if you go to the statute, I forget the actual language, but it talks about necessary medical expenses. And if you believe that the charges that are being approved by the disability board are inappropriate, your only remedy really is to go to Superior Court and challenge them. There is no, as far as I recall, I don't have the bylaws handy. I don't believe there's an internal review process with the disability board.
Okay, that means we are completely our authority. Whatever the proof, can we have some kind of input and or something that if we feel it is really, you know, out of ordinary and really not. I know I heard all kinds of, you know, horror story about, you know, hot tub or whatever that's, you know, related to that.
Well, about the only thing you could do, I think, is you could, you know, have a conversation with the local disability board about the approval of a type of claim that is being done repeatedly, or a single claim, or write a letter. But again, once the decision is made, there's no internal review process. Your only challenge is to go to court and say, you know, this didn't fall within the authority of the disability board because it's not a necessary medical expense. And, you know, honestly, I think that the preference is going to be given to the disability board because it's their decision. Courts are generally going to defer to their decision in most cases.
Okay, I think this really, I thank you again, Commissioner Merida. Highlight two things. Number one, those are really we cannot too much control. And then I'm really still concerned about our reserve on the left one. You know, do we have enough money to meet the expenses, because we cannot control it. And I also have a concern in here. It seems to me on the Mill Creek situation, I'm not completely aware where the stages are. It seems to be a lot of discussion now. I don't know when's appropriate that the board needs to be engaged and that type of thing.
I'll jump out, and I see Commissioner Metter, the chair of the intergovernmental, raise his hand, so I'll stand down. Commissioner Metter, would you like to speak?
The one issue about the left one, Linwood left one board meets once a month. I think the second Wednesday at 8 o'clock or 9 o'clock. Excuse me. And we didn't allow for any oversight or any involvement in that board when we brought Linwood annexed into the RFA. And it might be a discussion point whether we need to have one person attending their meetings, because just like Rich Davis said, they're pretty autonomous, and when they make a decision, we're pretty well bound by it. So the only way to maybe mitigate it, and I'm not sure we need to, but would be to actually have somebody at the meeting to understand their thinking and monitor the situation, because truly they are very powerful in the sense of obligating the RFA to their costs. So it's an idea. So
okay.
On the other issue of the Mill Creek involvement, the Intergovernmental Committee, including 3 commissioners, has been very involved. In fact, we just had a meeting at 3 o'clock, so we'll report back. But I think that the concern that Commissioner Chan might have is all commissioners will have their input on anything that happens. It's right now. It's a I'll make a short report later, but definitely it's not. There's no intent to exclude, if you will, the comments of all commissioners. So we'll get back to that later in the agenda. So I appreciate you. Yeah.
No, I didn't mean to be saying you're excluding it. Just I didn't know what state. I was just concerned about getting more detail now about transfer assets and stuff like that.
Okay.
So I'd like to know where we're at.
Okay. Yeah, I will do that. Thank you.
Any more questions or comments on the consent agenda? Seeing none, all in favor, say aye.
Aye.
Any opposed? Motion carries. Moving on to approval of our November 2nd, 2021 regular meeting minutes. We have a motion to approve as presented. Commissioner Medra. Do I have a second on the motion? Commissioner Lawrence. Any discussion on the motion? Seeing none, all in favor say aye.
Aye.
Motion carries. Moving on to public comment. Do we have anybody on the call wishing to make public comment? If so, please use the raise your hand function and be recognized. Give it a second here. I have about 15 people on the attendee side of the meeting. All right. Seeing no raised hands on the attendee side. Moving on to item 7, our fire chief report with Chief Hovis.
Thank you, Chair Urban. Good evening, commissioners. Start my fire chief report again tonight with our COVID-19 statistics. At the state level, reported on December 2nd, we're over 780,000 cases in the state of Washington. We're up above 43,000 related hospitalizations since the start of the pandemic. We're now at 9,413 deaths. On Snohomish County, information from the health department shows we have had 73,751 cases as of December 6th. So that's a 1-week increase of 1,281 cases. Of the cases since the start of the pandemic, we're over 4,000 that have required hospitalizations, and we're at 822 deaths in our county. So that's an increase of 9 in 1 week. Currently, the hospitals are still under stress. We have 51 patients currently hospitalized with COVID-19, with 17 of those requiring ventilators to breathe. Mike Vermeulen is going to show the 2-week rolling period COVID case count graphic. This still runs back to March 1st of 2020. We've had a decline and a little bit of a plateau, but we are still nearly at 300 cases. We're at 290 new cases per 100,000 people as of December 3rd. I'm going to show you a different graphic that is a little bit more encouraging. So just through December 4th, we have now 74% of people ages 5 and over that have initiated vaccination, with 67% fully vaccinated. That is good news. The case count continues to rise. We talked about the 290 for the 14-day case count, which is a -10 since November 27th. Thanks, Mike. With this uptick in COVID cases over the last week and this new variant that is getting a lot of press that is still being investigated, it continues to be important to take steps to prevent severe illness and reduce spread of the virus. So again, as we go into the holiday season, get fully vaccinated, including a booster if you haven't already. Mask up in public spaces, maximize ventilation when indoors, especially during the holidays, and avoid large gatherings when you can, particularly at those events where everyone is not vaccinated, and stay home and get tested if you feel ill. On South County Fire data, currently we have 3 employees off work due to isolation precautions. Total employees with COVID-like symptoms on quarantine or isolation since the start of the pandemic is now at 396, which includes 109 post-vaccination symptomatic employees. We've now had 44 employees who have tested positive for COVID-19 at some point since the start of the pandemic, with 7 of those positives potentially work-related. And we remain 92% vaccinated with our uniformed emergency medical providers, 92% fully vaccinated. Mike's now going to screen share our South County Fire First Watch graph, and this is going to show the 3-week period since our last meeting through 4 p.m. today, and that is a squiggly line. It has been very busy, but steadily busy, and not as busy as I'd reported at our last commission meeting in November. We've had 0 occurrences of call volume exceeding 3 times standard deviation, which is good. Looking at our calls in total, it's 3-week period is busy in the RFA, and really shows the scope of over 250,000 people we're protecting over 50 square miles. We had 1,903 calls since our last meeting. Comparing that to 2020, we had 1,625. So we had a 17% increase year over year, or an additional 278 incidences in the past 3 weeks as compared to 2020. Thanks, Mike. South County Fire has now transported 813 COVID patients, positive patients to date. And I've been continuing to report on unfortunate COVID-related fatalities nationwide for firefighters, and 4 more firefighters have passed in the nation due to COVID exposure attributed to their workplace in the last 3 weeks. Transitioning to South County Fire specific updates, commissioners, as you know, we've provided guidance to the Edmonds, Everett, and Mukilteo school districts in their ongoing efforts to vaccinate their 5 to 12-year-old students. As I continue to talk, Mike is going to screen share a message from Edmond School District Health Services Program Manager, Marano Bianco. And here she's thanking our staff for the outstanding job that they did engaging with families at a recent clinic held at Meadowdale High School. And I'll let you read that message. And she was one of the 2 individuals that reached out to myself and PIO Hines when they needed some help trying to figure out how to do this, and was our conduit that got this going with Everett and Mukilteo School District. So we've found an outstanding partner at the school district, and we're talking about other ideas on how to partner in the future. So it's a nice message, and a great job done by the team at headquarters, as well as staff in the field that have been on duty, available as a standby to make these families of the parents of the 5 to 12-year-old students, as well as these students, feel a little bit more reassured when they see the face of a firefighter there if anything was to happen. So thanks, Mike. Commissioners, this is a good time to mention that you too, if you're having difficulty getting a COVID booster and need one, you can reach out to Melissa Blankenship, who can provide you information on how one of the members of our team can provide a booster to you, if that's something you want to do and you've had some difficulty getting one. And I'll just leave it at that and leave that to you to contact Melissa. So we want to talk about South County Fire doing something in Mount Lake Terrace. Mike Vermeulen is going to show a picture of the Volunteers of America, Western Washington, Mount Lake Terrace drive-through food pantry. A reminder, we did this about a year ago, and this is a one-day event where there was 608 boxes distributed of food and other essential supplies to 111 families and 468 individuals in need in our RFA. Great event, and thank you for the members of the team that participated in that to support that event. Thanks, Mike. Commissioners, you know that our 12 recruits graduated last Thursday from the Snohomish County Fire Training Academy. That graduation went well. That graduation is many entities in Snohomish County, many fire departments, but we had the largest group, as we normally do. This outstanding group was recognized by the training cadre and the instructors with multiple individual and team awards. They're now in post-academy EMS training. They'll be transitioning to our operations divisions and to the streets of the RFA at the end of this month. Thanks, Mike. South County Fire participated in 2 holiday events this Saturday. I'll tell you, it was about 38 degrees in Briar, where this picture was taken here with our air unit and 2 of our volunteers delivering Santa. Thank you, PIO Hines, as a member of the Parks Commission in Briar, for helping coordinate this event. I would say there was probably 1,800 people at the event, and a great way to deliver Santa. And then Engine 15, not pictured in any pictures, delivered Santa also to an event at a church held in Linwood off of 178th Street Southwest as well. And I want to thank the crews that did this, as well as the volunteers that delivered Santa. Great event, great engagement with the community. And finally, commissioners, I want to notify you that firefighter Bryce Jacobson's official retirement from South County Fire was December 1st. Bryce served 34 years in the fire service. He started in Bossel's Fire Department as a career firefighter in 1987 and was a volunteer before that. He was hired by Linwood Fire Department in 1988 and joined South County Fire with the formation of our RFA in 2017. We want to congratulate Bryce and his family on his well-deserved retirement and wish him well in the future. And with that, thank you for the opportunity to provide a fire chief report this evening, and I would welcome any questions from the board.
Thank you, Chief. Well, not that any, I want to thank Station 17 for, again, offering up their location for Santa, our Santa, to change his clothes, and he rides the antique fire engine out from there. So thanks to staff for accommodating that. Commissioner Metter, you had questions?
Yes, I don't know what happened to Bryce under your, authority, but he had hair when he worked for me. So I don't know if something happened there. Don't know. It's just strange. I did want to comment, and we've been in the state of Washington, we've been under some COVID restrictions that actually made us close all our public entities, like for meetings, fire departments, the cities, city halls, and after 2 years of reflecting on this, the question is can we compare and contrast how other states have done this to see if we've been doing the right thing? The question is, and when I looked at the New York Times data on this yesterday, what I found was that the state of Washington has hospitalizations of 17 per 100,000. The state of, the country does. The state of Washington has 12 per 100,000. But then you look at the states that didn't close down, okay? And mostly in the southern states. And Florida, for example, has only hospitalization of 6 per 100,000, and their death rate is lower than ours. So the question, I found it very disturbing to want to go into City Hall at the city of Linwood once a month ago, and they're closed up. And yet you can go to any business in town and they're all open. I really question, and it doesn't do any good, the fact that I question it, but I have to make the statement that are we doing the right thing? In other words, in the state of Washington, are we really doing the right thing by closing down our public entities so people can't go into fire stations, can't go into city halls, can't go to other meetings, public meetings, any place? It doesn't make a lot of sense. I think data matters. And when you get data that doesn't support what you do, generally you change. But I haven't seen any indication there's any changes in the state of Washington. So it's a general comment, but for me, it's kind of, wow, what, who's running this show, So anyway, that's just my comment. So.
Any other questions or comments for Chief? Commissioner Chan?
Well, I think maybe this question to Chief. I know that we had that discussion about community room should be open or not. If the community room is used, usually they're separate from the crew, from everybody else, right? That's from my experience when I use it. If we use that, is that in violations of the state law? I mean, I don't want it in violations of the state law, but if it is not, maybe we can start opening it up for people to use our community room. So that's my questions.
It's a good question, Commissioner Chan. We've been talking about that. And
right.
Remember before the fifth wave started, I think we were really on the cusp of thinking that way. And then we had the spike. So we're continuing to look at that. I want to be able to Commissioner Metter's point. I sure wish I could have an audience, not that it would make much difference with the governor sometimes and some of the things that have happened this past year. It's frustrating for staff as well. And we'd sure like to get the community rooms back open and get back to in-person meetings as well. It's been a hard 2 years for all of us. So as we continue to watch this, and hopefully we see the 290 number continue to go down, and this new variant is, shown to not be something as bad as Delta was, I think we're getting closer. And I don't think that happens during the month of December, but as we get past into the new year, and myself and staff and Chief Maxwell, get Dr. Campbell back here, Dr. Cooper, some of our MPDs, I think we need to start having those discussions. And I think to answer your question, sir, I don't think it's a violation of state law for a community meeting room to be opened unless it was being used to hold a public meeting per se that wasn't having the rules followed. So we just have to talk through those things.
Okay, thank you.
Yeah, thanks.
Any other questions or comments before we move forward? All right, thank you, Chief. Moving on to our legal report with Rich Davis.
Good evening, Commissioners. During last month, we have continued to work on some vaccination and reasonable accommodation issues, although those are kind of getting down to a trickle at this point as we have proceeded well past the October 18th date for fully vaccinated employees. We've worked on some interlocal agreements and review of other agreements with third parties. There's been a lot of work on City Mill Creek and a potential annexation into the RFA. We have had a series of meetings. We've been briefing the Intergovernmental Committee, and I've attended those meetings. And we'll have another meeting with the city later this week. And depending on what happens with the city council, and I won't try not to steal the thunder from Commissioner Metter, but there may be action that then the governing board will be requested to take. The way these annexations, just to remind the commission, the way any annexation into an RFA works is if a city wants to annex in, they adopt a petition requesting annexation into the RFA. And then the second action that has to take place is that the RFA approves and adopts an amendment to the plan to kind of effectuate that annexation. So it's terms and conditions that kind of deal with that annexation. And then third, that goes back to the city that requested annexation to approve that amended plan and to call an election in the city. So I just wanted to kind of outline that for the board as potential actions that may be coming forward. I've also participated in a number of meetings with the city of Edmonds and their representatives to discuss the remedial measures, and again have updated the Intergovernmental Committee on that. And based upon feedback received today, I'm expecting to kind of respond to a question earlier, expecting to be able for a board briefing next week on that. In terms of something to look forward to, I know that Commissioner Chan, Commissioner Kinney attended the presentation at the WFCA, and there's an issue that's been of concern to EMS agencies, which deals with HB 1310 and reduced responses by law enforcement to certain kinds of calls. And there may be some legislative fix that is put into place this next legislative session. But in the meantime, most EMS agencies have seen some decline in law enforcement responses to certain kinds of calls. And the reason for that is because these law enforcement agencies are concerned about liability due to the kind of the clampdown on law enforcement for using physical force. And so we have proposed a template of a policy for consideration and tendered that to staff. I know that's being looked at internally, and I would expect in the near future that'll be something that we also will be bringing back to the board. I think that covers my legal report this evening. This is my last regularly scheduled meeting of the year, unless I'm called back. And so I do want to wish all the commissioners a happy holiday. And with that, I'll open it up for questions.
Thank you. Any questions or comments? Commissioner Chan? You're on mute.
Yeah, I'm not, okay, I draft up sometime what I call ideal commissioner, and I go through RCW 5214, which is stricken commissioner, and then 52.26 regional fire authority, and then 4212 about the vacancy. My question to you, a couple of questions in here. On the 1512, 5214 commissioner, that commissioner, the regulation that's applied to both regular fire authority versus, and also the RFA, is that correct?
In other words, do the commissioners have the kind of the same authority under both statutes?
Yeah.
For the most part, yes.
For the most part, so okay. No,
Yes.
interesting. I got too much time on my hand, but so I think we had, I think I knew sometime before on the 52.14.01 B, I read it to you, is that each member of the board, blah, 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 and expenses shall be entitled to receive the same insurance available to all firefighters of the district, provided that the premium for such insurance, except for liability insurance, shall be paid by the individual commissioner who elect to receive it. So does that mean now, as a commissioner, I said, I like the same insurance and I pay for a premium? I should able to do that, isn't it?
I believe that's correct. There's as you know, I've talked about before, the Regional Fire Authority statute incorporates the powers of RCW 52
Right.
for fire districts, as long as one of the participating members is a fire district, which it was in this case. One of the original members was Fire District 1. So it's my view that the statute applies for the commissioners of the governing board of the RFA. Yes.
Yeah, no, I think that's a good, I think as we're going to broadcast recruiting new commissioner, I thought that is one of the benefit that people will. And I wish I know about that, but I've been self-employed. The last 15 years, I've been paying my own. I wish I could have used the insurance of the fire district. So that's a good news. I think we should we, I mean, rely on you now, or do we need to do more research, make sure that when we do the recruitment for the, we can say that?
No, I know that this statute applies.
Okay.
So fire
Okay.
commissioners are entitled to take advantage of this.
Okay,
Yes.
no, I don't know. I was surprising when I read that. Oh, okay. All right, I wish I'd known. Thank you.
You're welcome.
Commissioner Kenny?
Yes, Mr. Davis, I was hoping you could give us an update on the federal overlay for mandatory vaccinations. I know that was supposedly coming in December. I've read about some federal lawsuits related to it, perhaps in other industries. And I was just kind of wondering here as we face December and then in January, what's the state of play with the federal requirements for mandatory vaccination for what would in this case be RFA employees?
So there was a executive order, I don't remember the number, that was passed by President Biden, and that directed OSHA to issue regulations, which OSHA did. They were not timely. They were issued in November, and I forget the date. I have not seen the state issue its own set of regulations. The way it works is for Washington State is we have to have a state plan that is as strict as, if not more strict than the federal plan. The OSHA regulations do not directly apply to local governments. And so even though those went into effect back in well, they didn't go into effect quite then, but they were published in November. That started a 30-day clock for the state to then issue corresponding regulations. Haven't seen those, and I don't know how close we are to seeing those, but those regulations will in fact apply to South County Fire. And again, because the federal regulations said that employers of 100 employees or more would be covered under that, I'm expecting the state plan to have the same provision in it. Now, there was another kind of, there was a different order that President Biden passed, executive order, and it directed CMS to adopt rules that I was kind of expecting. I think a lot of fire department attorneys were also expecting to kind of encompass South County Fire and other agencies. And it turns out that it didn't. Those regulations were published. Those are not really pertinent. But this one that President Biden has that cover employers that have at least 100 employees. And I have to confess, Commissioner Kenny, I think that there was a court that issued a stay on that, and I haven't kept up to breast on that over the last week or so. But bottom line is, we're waiting for the regulations to be issued by the state before we know exactly what's what.
Can you estimate how likely it is that something would come into legal force and become effective before the first of the year? In other words, are we going to have some bombshell that drops during the holidays that we're going to have to deal with?
I think you're going to have an implementation window of 30 days or so. Whenever the regulation is passed, it's not going to become effective immediately. So there's going to be some advance notice so that employers can plan for that and implement appropriate policies.
Thank you.
You're welcome.
Any other questions or comments? All right. Thank you, Mr. Davis. Moving on to our union report with President Hoover.
Thank you, commissioners and guests. I'd like to start off also by congratulating firefighter Bryce Jacobson. Chief, I think when I met him, he had hair, a little bit of hair as well, but it's been a few years. And also, I wanted to also thank Commissioner Drew for his time and effort working on this commission. I know he's not on this meeting, but just wanted to extend that out to him. As Chief reported, there's been 4 line of duty deaths of IFF members. Actually 5, I'm sorry, since November 1st, bringing that total to 73. I just wanted to let you know of a few things that we're doing within our organization. I know I reported that we did one Coats for Kids event in the Mukilteo School District. We're also trying to get one put together for the Edmond School District. This is a rather large one. We're looking at a few hundred coats that we're going to try and get out. So we're working on that currently. I wanted to also, during this holiday season, I wanted to thank Firefighter Beard, who takes up our Helping Families project, where our local members try and help support families in need during the holidays. She's got, I believe she said today, 4 families that she's trying to work with and get donations and get things for. And I appreciate she puts a lot of work into that every year. I'd like to thank our CRPs for their continued vaccination support. I know they are busy doing some booster shots, and I just appreciate the fact that they have put in that time and effort. The one comment that I want to make regarding the community rooms as just a thought, I too want to get those open. I think the communities really want to have access to them. One thought is, if we have multiple events that are going to occur in one day, the crews are the ones that generally do the cleaning of those rooms. And if we're busy with calls, just keep in mind that we may be only able to schedule one event per day, maybe, or something, or try and figure out the cleaning. Just not that the crews don't want to do it. We just sometimes might be busy. And if another event came in, we wouldn't want to cross-contaminate that. Let's see, we're coming up on the end of another tough year, and we look forward to working with all of you in the coming year to continue to move this organization forward as leaders in the fire service in the community. So with that, that is the Local 1828 report.
Thank you. Any questions or comments for President Hoover? President Hoover, with the Michigan school shooting, was everybody staying up to date on their body armor donning and all of those protocols? I know we had a couple.
Yes.
I know we had a couple, threats and things locally. So.
Yes, Chair Urban, I believe that we're very good at donning those protective equipment when needed. We have the ballistic vests and the ballistic helmets, and we're very grateful to have that safety equipment. Makes us feel a lot safer going into a lot of the situations that we do. So yeah, we are prepared for those.
Great, thank you. All right, we'll move on in our agenda. Item 10A, our Q3 Community Readiness section report with AC Fitzgerald, Assistant Fire Marshal Fitter, and Community Outreach Manager Sean Guzman.
Thank you. Hello, commissioners and staff and community members. Good evening to all of you. Normally, we present on a quarterly basis, kind of a summary of the fire prevention team's work. We're about 6 weeks behind on that because of a lot of work going on into the adoption of the budget, which has delayed the presentation. So we're going to share a screen presentation with you right now, and I'll kick that off and then pass it to the rest of our team members. This is a chart you're probably used to seeing by now. This is the 21st century white paper for fire and emergency services. I want to bring your attention to the upper right box, which is one of the 8 initiatives of the 21st century white paper. This is re-identification, and that'll become important here as we transition from fire prevention onto community readiness. And you'll see here under this initiative, this is about celebrating the heritage of an organization or a team, and recognizing that the services that we provide over time has evolved. And some of the strategies about the re-identification, here focusing on community readiness, is finding the names that better reflect what it is that we do, using modern perspectives and adapting our work to really what's going on in the community. So here we're continuing our work of community risk reduction, focusing on those things that are these allied relationships that we have between fire and emergency medical services, our CRP team, community outreach team. And here we're focusing on those things that are strategies for clarifying really what it is that we do in this role. Ultimately, all of this is about reducing the number of 911 incidents. We've heard about our CRP team and the work that our community resource paramedics are performing to help reduce the number of incidents to which we respond. That's super important here because that's the work of our community readiness team as well. And there's a lot of interrelated dynamics about the work that all those teams are doing. Here is an organizational chart that existed when you last saw this quarterly report earlier this year. Apologize for, at least on my view, it's not very clear. Hopefully yours is better than mine is at the moment. I want to bring your attention to the center blue box there where it says prevention. This is fire prevention. And on the next slide here, we're going to see that this has changed over through this re-identification process to community readiness and focusing on what we do as a community and serving that community through all of our different roles. We are ready to serve the community, and focusing on community risk reduction is the work of really a large team of, on our next slide, you'll see the faces of those team members. community protection is really, that's our fire marshal team. And down below is our community outreach team. Community outreach is a term that you're pretty well accustomed to. You'll be hearing more in the future here about our community protection team, which is our fire marshals working to protect our community through engineering methods and fire protection systems. And so now on the next slide, I'm going to transition over to Carl Fitter, who's going to really provide a summary of the third quarter work of the community protection team.
Chief, I know Carl was also.
Sorry about that. I wanted to thank you, Chief Fitzgerald, and good evening, Commissioners, Chief, and staff. I would like to mention to Chief Metter and President Hoover that you might be right, because when I first met Chief Hovis, I had hair also. So we might be onto something there. Our cities have been doing much better. And from the second quarter, business licenses are up in all of the cities. The one that is a little bit off here is Montlake Terrace, and that's actually because they had turned everything over to the state, and so it was a lot more difficult to get some of the information back. But we believe we were really close on what was done there. Our plan reviews are up, and our permitted inspections are up from the last quarter. So in all intents and purposes, it looks as if we're starting to thrive again, which is really great, great news to have, and that sort of thing. So I'll turn this over to, is it back to you, Mike, or?
Yeah, Shawnery is going to present the community outreach report.
Shawnery, sorry about that.
Thank you, Carl. Good evening, everyone. This is again our Q3 community outreach report for July, August, and September. And I echo your sentiments about being able to get out into the community and be doing some of those in-person events and having groups come into our stations again. We can't wait, and we're looking forward to the day when we can do that safely. Our activities continue to thrive, even though we can't be out in the community as much as we'd like. We have mastered the virtual format, and we've increased our engagement by about 500%. So we will definitely need to figure out a good way of returning to a hybrid type programming where we continue to do some virtual programming, but we're also in the community in that face-to-face capacity as well. So we'll have to figure out where that balance is, and hopefully we'll find that right balance. We have metrics that we track so that we can give you some accurate numbers. We reached about 38,000 people through our special events and activities. Our social media engagement continues to be steady. We did have a slight decline because I think people were taking a social media break, which is a good thing for our mental health, but we're starting to see that swing back up again. We continue to provide safety devices to our community that cannot otherwise afford them, and we pay for those through grants that are local, regional, and state funded. We have a couple of program highlights to talk about. We provided fire extinguisher training to all of the Edmonds Police Department, and we also talked about responsibilities being first on scene to fires and how they could assist our firefighters on the fire ground. We hosted a Snohomish County Falls Prevention Symposium, and we reached people across our county, the state, and even outside of our state to talk about the problem of falls. And we launched our CPR and AED pulse point application, and we're continuing to look for AEDs in our community so that we can get those registered with pulse point. Our class registrations continue to grow month to month, and so we've had 645 students register for our virtual classes. And as you can see here, we have our December classes that we're hosting this month. Next slide, Mike. And we're continually working, finding new partners. We've actually had an easier time finding partners during the last 2 years because everybody has gone to a virtual meetings and meet and greets. We are working to put a life jacket loaner cabinet at Lake Ballinger. We have a drowning death there about every year, with the most recent being an 8-year-old girl on the 4th of July. We've also become a Cribs for Kids Safe Sleep Ambassador. We're working with our local hospitals to also become ambassadors to hopefully eliminated child sleep-related deaths. We also received a grant from Toyota called Buckle Up for Life, where we received 76 car seats that we distribute into our community. And so far we've distributed more than half of those, and the need continues to grow. I'm just looking forward to 2022. We're going to continue to be data-driven in all of our thought processes, programs, include diversity, inclusion in all of those, and make sure that we're maintaining health equity. And we're going to use Craig 1300 as one of those data-driven programs that will help inform us of the injuries and the demographics in our area that are most vulnerable. So with that, that is my injury report.
Thank you very much. Any questions or comments? Commissioner Kenny.
Yes, Ms. Guzman, I had a question for you. Sorry, I'm just looking at this other screen where I've got your materials. Under new partnerships, you indicate Seattle Children's is and maybe I didn't quite hear a sponsor or a grant provider for the life jackets at Lake Ballinger. And is that for all the life jackets, some component of the life jackets?
So we have several partnerships that are going into making that happen. Seattle Children's is the fiscal agent for Safe Kids Washington, where we receive grant funding. They also are the fiscal agent for a foundation of a young man who lost his brother to a drowning. And some of the money that he's raised will help go towards the signage provided at the parks. And then our other partner would be Mountain Lake Terrace Parks themselves. They are actually providing the structure. So between all of our partnerships, we're all coming together to make this life jacket cabinet happen.
And is that only for Lake Ballinger? It doesn't include any of our other lakes?
We actually already have a life jacket cabinet in existence at Martha Lake.
That's what I thought.
We like to only put structures in places where there are safe swim areas designated. We don't want to give the wrong message by putting a life jacket cabinet in an area where we would discourage people from swimming. So we do more education in those areas without providing a life jacket.
Great, thank you.
Mm-hmm.
And then I had a question for Fire Marshal Fitterer on his portion of the presentation. And that was related to Linwood for Q3. Plan reviews, 394. That's a lot more than the other cities on that list. How does that compare to the quarter before?
I didn't hear part of what you said. It was the business license.
No, plan reviews. Your screenshot with the plan reviews for Linwood indicates for Q3 394 plan reviews, and I was just like, wow, that's a lot compared to the other cities. And I was wondering, how does that compare to prior quarters, or maybe just the quarter before Q2 in
it's actually
plan reviews for Linwood?
It's actually almost double what they had last quarter. There's been so much growth in Linwood, partly due to Sound Transit and partly due to just the large areas building up. They've had multiple what we call 5/2s, 5-story buildings, 2 parking garages, has a commercial center underneath on the first floor. And so it's attributed to quite a few more business licenses and also permits and stuff for inspections and that sort of thing. So
okay,
Linwood is huge growth right now, and as we all see, a lot of those growths go in spurts. I think you'll see Edmonds pick up quite a bit because of their Highway 99 changing the Highway 99. So you're going to see some much more growth there. With ST coming in, you're already seeing it in Montlake Terrace with Terrace Station 1, 2, and 3. 1's done. 2 is going to be by the first of the year. Building 3 will be by the end of 2022.
Great, thank you.
Amazing growth.
Yeah, really. And last, I had a question for Chief Fitzgerald on what you introduced initially in this presentation, and that was the rebranding issue. And so I understand you're changing your department's name to Community Readiness, with Community Protection being the new name for the fire marshal's function, and Community Outreach being, well, I've always considered community outreach could also be called public education. And I understand the latter, but I guess I don't understand the rationale for the overall department changing to Community Readiness. And maybe I'm just set in my ways regarding the fire marshal's office, but that says something very distinct to me. And then saying community protection, I don't know. So can you tell us a little bit about the rationale behind the rebranding?
Certainly. Yeah, I appreciate the question. I'd be cautious about calling it a rebranding, though. We're not rebranding. We're just using the terminology provided by the 21st Century White Paper, which, as you know, has guided us throughout our budgetary process here, and utilizing that first initiative of re-identification. So to me, whereas rebranding to me sounds like an expensive endeavor, in this case, we're just exploring our identity in a different manner. The fire marshal's office historically has a lot of different connotations for different people, but it's really a team approach that involves education. It involves engineering, the work of inspection, the work of investigating fires, but it's really the work of reducing risks in our community. And by that, we've assembled really a hugely talented team of people on the historically fire marshal side and the historically public educator side, and bringing those all together, as well as considering what other future endeavors within our agency and our needs on a community level, what they look like in terms of exploring different opportunities within and under the guise of community readiness. That's where we've kind of landed here as a term, and quite honestly, we're just kind of exploiting the existing terminology of community outreach and expanding that to that historically traditional team that we've called fire marshals.
Okay, thank you.
Commissioner Chan?
Yeah, I think this may be appropriate since we talk about 21st Century White Paper. Actually, I probably addressed to the Chief Hovis too. Yeah, I like the white paper. There's a lot of concepts good, especially Fitzgerald, Chief Fitzgerald talk about the budgetary, using that as a budgetary. The critical part is I know that there's a lot of disappointment when some of the budget we cut back and not able to fulfill what you guys request on. But I think, and I also, you heard about, oh yeah, that reduce call and all that stuff. I think we got to be really, eventually next year we will sit down with Chief Hovis, and when we implement the whole thing, how much going to cost? Because the problem is that we have to balancing what we can afford versus right away. And I do not want you to be discouraging, saying, right now we said, no, we don't want to use that. It's not that we do. I know you mentioned many times we're reducing costs. We understand that. Is Chief Maxwell here? I don't see it.
He's not, no.
Oh, it's okay. So he and I have a discussion about data-driven. How do we respond to call back and forth? And the reason I'm bringing this up is that today I thank you for Chief Hovis that I got them booster shots on the station 15, and while waiting the 15 minutes to be make sure I'm okay, and I have a really good conversation with CRP Anderson, and she is passionate. She really wanted to save every person. I really appreciate people like that to really have the community. But I also explained to her, there's some restraint here. It's not that we don't want to spend money, and we're right now the burden thing that we're working on it. I just hope, hopefully, some of the staff understanding the restrictions. And I think eventually, I would like to have a very good budget discussions with the major people, really more sit down. I know Commissioner Merritt and Commissioner Shaw at one time trying to open up the budget during the recession time, explaining what we do. I want to, again, hopefully you guys don't see us because we do not do the funding right now is a negative thing. Especially when we're right now, we're looking at outlook. As we everybody know, in 2 years, our expenses were exceeding our revenue and we're negative banking. That's the one thing we need to balance out on. So in summary, I encourage doing that, but however, we cannot just because of white paper asking to do it, we may not able to do it at this time. Hope you understand that. And
I appreciate that, Commissioner Chan. And,
yeah, I know. So one more thing.
Okay, go on.
Cushman have classes that should not Cushman. You know what I'm talking about. Should definitely have really a lot of good classes out there, and that really can help us. So I appreciate all the outreach program. Go ahead, Chief.
No, I appreciate that, and Commissioner Chan, I'm glad that Jeanette was able to help you today and get you a booster. And want to make, like I offered to the other commissioners, I think that's a great thing, and it's great to have that engagement. I think staff's in a good spot. I just 21st century white paper, we still have 78 years or so to go in this 21st century, trying to set a principle and a philosophy and a lens going forward. I won't be here for those 78 years. None of the employees here now, but it's a philosophy that we're working towards. And kind of this re-identification for our organization is talking about the things that this RFA offers that weren't not offered or have been built upon since the contracts for service with Mount Lake Terrace, Briar, and Edmonds were formed. We're doing a lot of different stuff, and it's not in those agreements. So as we continue to use words that more closely recognize what we do and connect with our communities and build upon our programs, and as our partner cities join our RFA and other cities or fire districts might look to join us in the future, we want to lead from the front, and that's what that paper is about. But staff's in a good place post-budget. It was a long process, but I thank you for your kind words, and we've all got smiles on our face in this office behind these masks. I will mention that Carl is doing double duty tonight. He's attending the City of Edmond City Council meeting, so if he needs to go at some point, he will need to go. So if there is any questions for Carl, I just want to make sure that I note that. Thank you.
I'm sure he's still listening to public comment. So. Question for Shawnery. I've got a board member who is very much on pedestrian safety, given that he was hit in a crosswalk many years ago. And then there was another incident at 5th and Walnut recently with pedestrians in the crosswalk. Do we have any outreach on pedestrian safety stuff that we do? Like, how often do we utilize that? He's wanting to try to get a bunch of safety vests and offer them for free around town, things like that. But just kind of curious what we have.
Yeah, we work closely with Target Zero, Snohomish County, and they actually have great funding. This past year, they had about $20,000 worth of funding for us to pay for implementing crosswalk flags, paying for overtime for our officers to do emphasis patrols, educational and enforcement. We had a multi-level approach to that. We used the maps and data to define the areas that we focused on this year. But we know that when we did some outreach, Leslie had put our pedestrian safety project in our newsletter. We had posted it on our Facebook page, and we did get community comment about places in or around our RFA where our citizens believe that they had high risk. And so we listened to those, and we're taking those into consideration next year. Any project that we do, it's not a one and done and we move on. We want to keep watching to make sure that we made an impact. If we didn't, we'll pivot and try something new. If we are making an impact, we don't want to take our thumb off that pulse. We want to keep it there to make sure that we don't backslide. So we are open, and we're already working with the city of Linwood and the city of Edmonds. The Highway 99 corridor, a lot of areas there are very high risk. So definitely have some plans going into 2022, and feel free to send anybody my way. If they have some recommendations, we will take them and listen to them and most likely implement them.
Great. Well, I'm sure he'd probably be a good disseminator of that educational material. So I'll make sure to connect him.
Absolutely. Thank you.
Commissioner Chan.
Oh, I just remember, Sonnery, we have a fall program. Is that a specific name on it? The fall prevention program? Do they have a special name for it?
Yeah, they're the fall prevention, veterans and prevention program. But as we're looking at that identification, really they're home safety, stewards of home safety. So it's not just preventing falls, but they're really looking at the whole home environment, putting up smoke alarms. And
right.
So we're going to look at kind of a re-identification for that group as well. But their primary focus is on falls and assisting the CRP team and those kind of lower level, lower acuity patients that they work with.
Yeah, actually, I did fell about a month or so ago and hurt my shoulder. And I went to my doctor and explained to her, our fire department had this program too, and she was curious. So can they just get on the website and they can find the whole program?
Yep, we have the whole program, and we have a registration form to request a home safety visit, which we'll schedule and come out and kind of take a look at the home environment and get to know the resident, whomever requests it, and see what their barriers are to being safe at home.
Okay, great. I'll give the information to her so she can, spread out. She's specialized in old adults. So.
I can also send Melissa a flyer for that program. So if you'd like to, and she can get that to you.
Oh, that'd be great. Thank you.
Mm-hmm.
Any last questions, comments before we move forward? All right, thank you. Moving on in our agenda to item 11, our committee updates. We'll start with 11A, or Capital Facilities Committee, with Commissioner Kenny.
Yes, we're going to have coming at the meeting coming up. Sorry, just looking at the calendar here. Yeah, the last meeting of the month, regular meeting of the month, the 21st, will be phase 2 of the Capital Facilities Plan. Will be presented to the board. So the board previously authorized that in the summer as one of the Capital Facilities Plan Committee recommendations. And so that will be coming up soon. In addition, and so you'll see that come out in the packet before that meeting. In addition, there's an update on the Verdant Value Village property. So I want to turn that over to Chief Eastman for a discussion about kind of give you an update on what's going on with that.
Thank you, Commissioner Kenny. I'll make this brief. So I think the board was all aware that we got the phase 1 environmental study done, identified a storage tank on the site that has now been confirmed. And the consultant's recommendation was we needed to move to a phase 2. The consultants we used in the phase 1 identified an ecology grant that's up to $200,000 that would help us do a whole bunch of stuff from the planning perspective, which includes identifying how big the tank is, doing samples of what's in the tank, soil samples around the tank, and really what this does is determine if there's more in-depth analysis into potential environmental impacts as a result of the tank. We have submitted that grant, and just it's an ecology grant, and I don't exactly know the name, but we were required as the people who want to improve the property. It's a grant for folks that are looking to improve property. It's a grant for them. So Verdant, or Hospital District 2, was not eligible for the grant. They actually are currently owners of the property. So the grant was submitted on the 18th of November. We should know, I want to say late January, early February, if we're being considered. The grant funds won't actually be available until mid-March of 2022. And this specific grant, you're not able to spend money ahead of time and then reimburse yourself for. So we're kind of on a holding pattern with the Verdant property until we see the results and if we're awarded the grant from ecology. The other thing that went along with that is, if you recall, we had an exclusive letter with Verdant to purchase the property. That letter was set to expire November 15th. In conversations with Verdant and Hospital District 2, specifically with regards to the grant and how to proceed forward, they have extended that letter. We had Rich Davis work with Hospital District 2's legal counsel through the end of March. And so what that does is get us in the same position where, if the RFA wants to purchase a property, we are it. And we have that option right now through the month of March. So that's kind of in a nutshell where we are. There'll be more to follow, especially if we know we're going to get the grant. We'll continue to do work with the consulting group, but little bits until we know we're going to get the funding. Then we can brief the board on the total scope of what that is and get into a little bit more of the detail. This is not funding to be used for the mitigation purpose, though. This is funding from the planning point of view only, and you can use it for a wider range of things. You can use it for several things. So like I said, we're waiting for that, and as soon as we get word where that's going, we'll make sure we inform the subcommittee and the board, and we'll give further details once we have more information. So that's the update with Value Village and the work we've done with Verdant to date.
Commissioner Chan?
Yeah, if the survey, done all the survey and everything, are they able to estimate the cost of the treatment to the Trump? They get out and all that. Would they able to estimate the cost of it?
I think that's what the phase 2 environmental study will inform. And so what will happen is when they do the work with the phase 2, they will have a much better understanding of what the cost to mitigate will be. And so for us, what that means is if we continue forward with purchasing the Verdant property, it gives us information to be able to potentially negotiate on price. As you know, that the owner of the property owns the problem.
Right.
And so what we don't want to do is purchase the property and become owners of a problem that exists prior to us. So there's several ways, and we've been working with Rich's office. He's got one of his partners is very, 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 very well vested in this. She's been doing it in this state for 25 years or more. We've been in contact with her. And so it will inform, if we move forward with the purchase price, if we have to make adjustments for that purpose, we'll be able to do that in an informed way.
But also too, that's a long time ago. I was involved with a tour company. We do have a garage, we have an underground tank. There's a federal government grant that able to help costs to dig out the ground, dig out the whole thing. I'm not sure it still exists, but I think it should be. So that's something you might want to look into. That might, reducing the cost on both sides and help us. Yeah.
Yeah. So right now, ecology is looking. There's end of year funds. So we actually met with ecology as part of the process for the submitting for the grant. And so ecology right now is looking for ending year funds that haven't been assigned to anybody that we could potentially use to do a mini phase 2 until we know whether we get the full grant or not. And then they have a whole slew of other available money with regards to mitigation aspects. The nice thing about the mitigation money is you can actually start the work get the mitigation money and pay yourself back, and you can pay the mitigation money backwards. Once again, Rich's office is well versed in that also.
Okay.
And Rich, I can't remember her name, but she's well up to speed with that, along with the consulting group. If we will continue to source funding for mitigation, depending on what that is.
Great.
Any other questions on this topic? All right, thank you, Commissioner Guinea. Moving on to our intergovernmental committee with Commissioner Metter.
Thank you. The Intergovernmental Committee met today at 3 o'clock and with the full committee. The purpose of the meeting was to bring us up to speed with the Edmonds situation, the mitigation issue, and as well as with the city of Mill Creek. And so we're really close on the Edmonds. I think there will be resolution to that issue. We're really close, but it's not done until it's done. The Mill Creek situation is hopefully they will take action on a resolution to annex into the RFA at their, I think the 14th, is it, Chief? At the 14th meeting. And an update on that is that there's been a counter offer, if you will, from Snohomish County Regional Fire, but it doesn't seem to be overly serious for us. But we don't know. It will be in the hands of their counsel, and we've always had a good relationship with their counsel throughout this whole process, and we're hoping that they'll take action because the situation is to get the tax money if they were to annex. Excuse me, I'm losing my voice here. To get the revenue from the taxes, they have to have a positive vote in April, and so there's a little bit of a time issue, but it's in the hands of Mill Creek. Then it comes back to us, and then we'll debate, and the board will take action. And right now, I'm hoping personally that we're positive on this, and we vote to accept their resolution and accept their membership into our RFA. But there's a lot of little details that still have to be hammered out, but overall, it's been going very well. So is there any questions? Thank you.
No, Commissioner Kenny.
Yes, Commissioner Metter, on the Mill Creek issue, is how has the resignation of the Mill Creek city manager played into the issue?
I'm not into the political part of that. Maybe the chief can speak to that a little bit.
Yeah, it was Commissioner Kenny and Commissioners, it was a little bit unexpected. We knew that the city manager had been dealing with some health issues with more than one of his family members. The transition has been a good transition because the team from Mill Creek has had many members of staff. They brought on a deputy city administrator that was previously with the city of Seattle a few months before city manager Caravino's departure, which helped the transition. And Mayor Holtzclaw called me the following day and really wanted to reaffirm that they still wanted to continue to talk through the process. So to answer your question, the transition has been fairly seamless. I think the departure of the former city manager maybe provided an opportunity for Snohomish Regional Fire and Rescue to try to re-engage with the city to talk about them continuing services. But other than that, from our perspective, from staff, it's been fine.
Well, one additional question: the December 14th, if the Mill Creek City Council is going to be taking up an issue to petition to annex to South County Fire a week from today on December 14th, I'm just guessing, but based on my experience, there must be a significant number of documents that underlay the promises made about what's going to happen in relation to that. I haven't seen anything. So I'm wondering, when are we going to see all the documents related to the annexation petition and what South County Fire is promising to Mill Creek as part of this, or perhaps Mill Creek is promising to South County Fire? There's been an absence of any documentation. So I'd be curious, when is the board going to see that?
The plan is to, again, have a commitment from Mill Creek first, so we can act on that. We'll bring all the documents back. Rich Davis has worked up 3 different documents. The committee has been in touch throughout this whole process, and I think the board is going to be happy with the results of our work. Now, that's the reason for the committee, that we would work through this, hand in glove with administration, so that when we end up coming back to the board, we're going to show due diligence and show the board members that weren't part of the committee that we've really handled, and this thing has worked out to both. It's a win-win for us in my mind at this point. But if for us to go through a long period of explaining and going through each document, it's going to happen. But it seems like the appropriate time is once we have a commitment from them to join us, and so that's what we're waiting for. But the committee's been working hard on it, and we've had great success with the staff. So I think you're going to be happy with what you see. But if it's something wrong, you'll have definite time. There's no commitment on the board's part until the board actually votes on this.
Well, Commissioner Metter, I would just respond by saying that my guess is the staff, certainly staff, maybe the committee, is making representations or promises or hints to Mill Creek about what is or isn't available or on the table or doable, particularly if there's, as you've indicated, 3 different documents that Rich Davis has in circulation, I guess, amongst South County Fire and Mill Creek, City of Mill Creek. And so, I'm just thinking, before the train leaves the station and things get really public, what those promises are. The devil's in the details. And, it might behoove staff and the committee to bring those items to the board, because once they petition, it would not be, it could be problematic if you've overpromised and underdelivered.
Yeah, I understand that. Like I said, there's no overpromising on either side until both parties agree. In other words, both parties vote as a unit. In other words, their city council votes and we vote. And then at that point, then the disclosure goes out to the public, and then they'll get a chance at, looking at the issue. So I think we're in good grounds. I think that everything is going smooth, but we'll see. Like I said, but at this point, we could have had a committee of the whole on this, but there was decided to do an intergovernmental committee of 3 commissioners. And so I think the 3 commissioners have worked hard. We've had good labor support. We've had good staff support. So I'm happy that there's no commissioners that won't be able to read and make an argument for or against before the whole board will vote on this. So anyway, it's not a done deal, and it won't be a done deal until we look at what the resolution says, and we end up with a chance to go over the documents, and we end up with a opportunity to query the issue and then go and then take a vote on it. So I'm confident that it's an open process, and it will be continued to be an open process once once Mill Creek makes their move. If they don't move on it, then it's a non-issue, and there's nothing there. We're not. So anyway, that's where we're at. So.
Thank you.
Mm-hmm.
Great. Moving on, Snow 911, Commissioner Chan.
Yeah, there will be a future facility plan tomorrow, but there's a lot of people participate, so they may have to reschedule it.
Okay.
Actually, by the way, are we gonna, I thought somehow in the last meeting, we said we'd come and talk about the discussion about recruiting the new commissioner, but I just realized I did not see that in the agenda. Are we going to have an opportunity to talk to Melissa about that whole issues and updating us on the information?
Well, we outlined the process at the last commission meeting, and
Right.
the advertisement's out there. So the
Right.
collection of resumes is going to be coming in over the next couple of weeks. So we can definitely have a more robust discussion on our work session without still reviewing the current application. So if there's desire to discuss qualifications and types of.
Okay, somehow I got the impression that we'll have further discussion about how much more we're going to be recruiting it. Especially, I like to see some money to spend on the newspapers, such as Herald or local newspapers, so people are aware of it. Is that okay? Is there some budget in there, Melissa?
I know that some paid advertisement through the Herald has gone out through the weekend, correct? Okay. Are there any, and if you have suggestions, Commissioner Chan, on any other community media that targets that area specifically, please do feel free to reach out to Melissa, because we don't have any kind of strict budgetary cap set on this at the moment.
Okay. So actually, I probably can defer that. I did write up what I call ideal commissioner. Auto quality, I like to maybe put on the agenda on the workshop on next week, so we can discuss that, and we use that as a kind of criteria how we select the candidates. I think it's good to have some kind of rethinking, agree on certain criteria that we want the commissioner have, so we have look at the whole interview, have an objectively, rather than, oh, I like that guy, I like this guy, but what criteria we use. I think that's important. I would suggest that we discuss that on the next workshop meeting.
Okay. Then I want to touch on, with the departure of Commissioner Burnett, our CFO committee is down to just Commissioner Metter, who has 2 more meetings left. And I know there's a candidate that's come to light and a desire to try to do an interview. So I'm going to appoint Commissioner Chan and myself to the CFO committee alongside of Commissioner Metter in order to help facilitate an interview of that candidate. Hopefully can find some good stuff there. And if not, then of course we'll be looking into 2022 for additional candidates and see where that process moves. So anything else for committee updates before we move on to, yes, Commissioner Metter?
I'm just going to ask Commissioner Chan on is Snow 911 definitely planning on moving their facility?
Yes, I think they will do one. Actually, I kind of, yes. They one time they talk about co-location with Department of Urgency and other things. So I don't know where we're at now.
Okay.
We did talk about at one time, I know Chief Hobers, I don't know, have talked about our Lincoln property, that type of thing. And they didn't look at that further.
No.
Yeah, they have a committee that they formed, and they have a consultant. I had planned not to attend the meeting either, Commissioner Chan, just because they're afraid of having a quorum. So we'll find an update, but our Lincoln property is within the geographical area and the elevation that they're looking for. It sounds like at this time that county DEM is out, as well as the sheriff's office, which may reduce the size of the property and structure they need to build. That's the last I've heard from Director Mills.
Okay.
Great. Moving on to commissioner comments. Any commissioners wishing to make comment? Commissioner Chan?
Well, everyone know that I've been serious looking. I did not like my current house, and I've been looking for, for a new property. Of course, that was the reason I tried to run for at large, because I don't want to restrict it to my own area. So finally, happy to tell you, I'm getting tired. People look at my background picture, right? They keep on asking, where's the lake? Is that from Yosemite or whatever? No, I said, that's a lake I used to live for 30 years, and Commissioner Schrock was right across the lake. But I'm happy to say, just an hour before the meeting, I got a key to, to a new house. The same lake, but not exactly the same view, but close enough. And so financially I'm broke, but mentally I'm good. So I'll be moving there probably next week.
We look forward to your new background image.
Yes, no, I'm going to invite everybody in this Zoom meeting. In the summertime is great for boating, fishing, swimming, great barbecue when the weather's good. All right.
All right. Any other commissioner comments? I'd like to recognize an uncle of mine, David Walker, who lives in Ohio, passed away today, heart failure, and just kind of express my sympathies to his wife, Karen, and his 3 boys. It's gonna be a little bit tough, but just wanted to recognize that. All right. Well, we're going to be moving on to an executive session, a 2-part executive session. One for collective bargaining pursuant to RCW 4230-144, and also review the performance. We'll call that meeting for 45 minutes to start, with the potential to extend, and we may potentially take action on one of those items at the end of our executive session. And so we'll go ahead and close it on this meeting. It's 8:37. Let's go ahead and rejoin in the executive session link by 8:50. So go ahead and take your break now, and then we'll see you back in the executive session with the potential to come back for action. All right.
The executive session has been extended for 15 minutes. The executive session has been extended for 20 minutes. The executive session has been extended for 15 minutes.
All right, we're returning from our executive session and ready to take action on the DC contract that was presented. Do we have a motion to approve the negotiated DC contract? Motion from Commissioner Lawrence. Do we have a second on the motion? Commissioner Teoflack. And any discussion on the motion? Commissioner Kenny.
Thank you. I am opposed to the contract. I believe this contract is not a good contract from the management perspective. I work with all of the deputy chiefs. I enjoy working with them, work with them closely, and this is not about a personal issue related to any of them or the compensation they receive, but rather an issue from the management perspective of this contract. One of the hallmarks of our contracts, labor contracts, this is our first labor contract with the deputy chiefs, but I'm speaking of our labor contract with Local 1828 and its predecessors, has been about what is the average or the average of the comparables. And we have a list of comparables from our current contract with Local 1828. And those comparables are the fire agencies at Bellevue, Central Pierce, Eastside, Everett, Puget Sound RFA, Redmond, Renton RFA, Snohomish Regional Fire and Rescue, and Tacoma. And so we focus a lot on what is that average. We generally try and be around that average. One contractual reason why we are around that average is because we are required to by our City of Edmonds contract. And if we go above the average, South County Fire pays the difference above that. So over time and many contracts, we've been focused on being at the average of our comparables so that we're not paying too much, but we're not paying too little, because we want to keep up with the market to make sure that we are fairly compensating, but also able to retain employees. This contract deviates from that, what we have done in the past. Our own information from the management and our attorney is that the average of those comparables for the deputy chiefs, the difference between the battalion chiefs and the next step chief, whether that's these different agencies have different names for that next step chief. For us, it's deputy chief. That difference is 17.24%, 17.24%. So that's the average. What the board authorizes here and what management authorizes here is 21%. So that doesn't sound like that many percentage points. That is a difference. That is a difference of 3.76 percentage points. But part of this is about the principle. And that is, well, 3.76%. Why are we doing that? Well, it's easy. How it allows us to settle this contract. Okay. But we don't have to do that. We shouldn't do that. We should stay at our average of our comparables like we do with our main contract with Local 1828. The cost of that, according to my calculation, the difference between the 17.24% and the 21% is about $30,000 a year in perpetuity, or for however long these contracts last. But the issue is not so much the money, because in the context of our $80 million plus budget, $30,000 a year is not that much money. But it's that percentage, because if I'm President Hoover and I'm looking at this and seeing that, well, for the deputy chief's contract, the board's happy to go 3.76% above the average of the comparables. Don't you think he might be using that argument for the negotiation on the main contract next year? Principles matter. The board just is willing to go at 21% to settle this when it doesn't need to. That may come back to bite the board in the future, because principles matter. We move away from the principle that we have in the past with the deputy chiefs of not having a fixed percentage between the position below them, the battalion chief, and the deputy chief. This contract does that 21%. The challenge is that sets a floor. This first contract with the deputy chiefs, how likely is it that this is ever going to change? 0. It sets the floor. And if things cost more the next time we do or the wages are higher, the next time we do this contract, it won't be going less than 21%. It'll be at least the 21%. But that differential between the battalion chief and the deputy chief is concerning to me separately, because in the past, at least in my time on the board, South County Fire and its predecessor, Fire District 1, have tried to move away from that locked percentage amount. Now, it makes it easy for management to have it because we have it in lots of other areas. If you look at our main contract with Local 1828, Article 28 wages at page 19 of the contract, there are a whole bunch of percentages and they're all related to the senior firefighter wage. So rescue hazmat pay is 3% more than senior firefighter. Paramedic is 15% more than senior firefighter. Captain paramedic is 23% more than senior firefighter. Captain is 20% more than senior firefighter. MSO is 31% more. Battalion chief is 44% more than senior firefighter. And now this contract bootstraps into that by 21% more than the battalion chief, who's 44% more than senior firefighter. And so that 65%, the deputy chiefs are 65% more than a senior firefighter. The challenge is that everybody's then focused on senior firefighter, and people that are representing management, deputy chiefs, and everybody that's at the table on the management or the labor side is going to be focused on senior firefighter and how senior firefighter needs to go up. And when it does, then everybody, it's a pyramid, everybody up the food chain eats because of that. And this was an opportunity. Now, we can't change that in the main contract with Local 1828. It's already set in stone, but we didn't have to do it on this contract, but the board decides to. What would have been a better path is to reevaluate every time we do the contract. What is the market? Is it 17% the average? What is it at that time? Because it might go up, it might go down. Just depends on what the market is. And we want to stay fair with the market. Here, it locks in at 21%, and you know it's never going down. So I'm opposed to this for that reason, because now we lock back to a senior firefighter wage, and that's really got nothing to do with deputy chiefs. But it is what it is. What the board decides to do with that, I think that is problematic. The board is giving away money that it doesn't need to give away, and I think that's a principal problem for the future, starting next year, where the dollars are a lot more involved than the money here. So for all these reasons and others that I won't go into at this time, I'm opposed and will be voting no. Thank you.
Any other commissioners wishing to comment? Commissioner Chan?
Yeah, it has been very difficult for me. I really like working with all the deputy chiefs. They have great people and everything else. But as I said, in my articles, in my statements, we got to keep, the organization healthy. And then I'm also one who will no to the budget, because we are looking at, will be negative cash. The revenue, well, we'll keep on spending more money than we take in, and depleting the reserve. And then in 3 or 4 years, our bank account will be negative. That's a critical issue to our taxpayer. I represent the taxpayer. And also now, as Commissioner Kenny has mentioned, this group is smaller amount. It does not, but however, using the same amount, go to the main contract and negotiate next year. I think that would set a really bad precedent. I want all employees pay fairly and everything else, but we also have to look after the financial conditions of sub-county fire. So unfortunately, I have to say, agree with Commissioner Kenny. I vote no.
Any other comment before we move to a vote? Oh, seeing none, all in favor, say aye. Aye. All opposed?
Nay.
And so it's a tie, which means the motion fails. All right. Anything further? All right, we'll adjourn the meeting. It's 10:34.